I want you guys to think about that for a second. This is not your fault. In fact, today, even getting ready for this shoot, the woman doing my hair said, "Wait, what are you talking about? You're talking about PCOS? What do we do about it? I have PCOS." I feel like I can't go anywhere without having a conversation about this disorder because there's just so much confusion around it. But PCOS at the end of the day needs to be rethought and re-diagnosed in a much different framework. Let's look at what the research is starting to say. And I feel bad for so many of you out there struggling to get answers because this is such new research. And what happens with research is it often doesn't translate into the exam room for another decade or even sometimes for another 20 years. Here's another article. And I'm just going to read it. And I know that's probably boring, but I'm just going to read it out loud to you so that you understand what the research is saying. So this is from the Journal of Assisted Reproduction and Genetics. And essentially it's saying hyperandrogenism. Remember, that's the overproduction of those hormones that I was talking about, which was a part of the initial Rotterdam criteria. Hyperandrogenism causes insulin resistance and hyperglycemia, high blood sugar. And then that in turn leads to, and I'm going to use a lot of big words, but these are the things we dig into in practice day in and day out. It leads to oxidative stress, which is the ability of your cells to withstand the environment, other things that they're getting exposed to. But hyperandrogenism leads to more oxidative stress. It leads to belly fat and abdominal adiposity, and it leads to, and here's the big word, inflammation. And over time, those particular very functional medicine ideas, right, of inflammation, oxidative stress, belly fat, all of these things lead to disease. So there's a link, for example, between PCOS and many different diseases, including mental health disorders, cardiovascular disorders, autoimmune disease, having additional autoimmune disease, and of course, cancer. It's all connected. It's all linked up together. So when we look at the research and when we look in the exam room and when we look at traditionally what's been happening, we know that there has to be a new way to diagnose and understand PCOS. And simply using the Rotterdam criteria is not enough. And being told that you don't have cysts on your ovaries, therefore you don't have PCOS, is not the answer moving forward. Let's dig a little bit now into what we do need to do to get a better understanding of PCOS. When we look critically at PCOS statistics and we understand that it is very underdiagnosed and that so many women today are walking around with PCOS and are unaware of it, even though the stats have risen and they say 1 in 10 women today, maybe 1 in 20, have a true in the exam room diagnosis of PCOS, we need to understand a little bit better about why the rates of PCOS are increasing. I get asked this all the time. What's happening? Why are we seeing so much PCOS? Is it simply because we're more aware of it? And the answer is no. Here is what's happening in the exam room and also in research, what we're actually seeing day in and day out. PCOS is increasing for a number of reasons. When I turn to the research, it's fascinating. It's talking about the prenatal environment and how the prenatal environment, if, for example, your mom had high androgens or high insulin, you're predisposed to PCOS when you hit puberty. But here's the even more interesting piece of the puzzle. Prescription medication usage is tied to the development of PCOS. They are finding that antidepressants, anti-anxiety medications, anti-seizure medications are all linked to the development of PCOS because they are changing the prenatal environment that maybe you or your child or your loved one was exposed to right from conception. This is mind-blowing to me, right? Because for so long, it's like, oh, we're stressed or we're eating bad food or, we're doing all these other behaviors and that's why we have PCOS. But it's winding all the way back to what is happening in your mother's environment. And that's just the start. As those androgens continue to build and you're exposed to androgens, not just prenatally, but now as you go through life and you get them from processed food, from the environment. Again, we've got studies talking about how BPA, endocrine disruptors, phthalates increase the amount of androgens circulating in the bloodstream. We now need to think about this idea of the cumulative load, right? I've talked about it in reference to other conditions and other diseases. I talk to patients about it all the time. And I think one of the biggest challenges we're having in medicine, and that's why this holistic approach I think is so important, is that oftentimes it's not a singular hit that is causing a singular problem. It is a cumulative load that eventually is leading people down a particular path. And same is true for PCOS.